Shawnee County Board of Health for our quarterly meeting.
Good morning,
Good morning.
Commissioners, Board of Health. We've got quite a few things on the agenda today. We'll go ahead and get moving. One of the first things we're going to talk about is the updates regarding the space relocation for the local health departments. So with that in mind, I just want to remind everybody that there's going to be two major parts to this move. Currently, we have staff that are located at the North Annex. We have staff that are located at Central Park Community Center, and we also have staff that are located at the 8th Street building. So the first two pieces, we are planning on moving select programs into the 10th Street Clinic and also into East Circle Drive. And we will have staff that will remain at the North Annex. So this one, the 10th Street Clinic, this is an area that is already in use by the Community Health Center, and it is actually designed for clinic type work, which is what we're going to be moving over into that building. But you can see the services that we plan to have in there by the end of this year include our communicable disease investigation program, our HIV counseling and testing, immunizations, our sexually transmitted infections clinic, and tuberculosis clinic. So we'll have a variety of clinical services that will be provided out of this location. And the only things that we're really going to need to have done to that are just the inclusion of a concrete pad and a generator to help support the vaccines that are going to be located on site, but minimal repairs other than painting, cleaning, things of that nature.
Sure. How is space being made in the 10th Avenue facility?
Pardon me?
How are we getting the extra space to move programs there?
We will be moving Community Health Center staff back to the main agency. As they get back, we'll make some minor repairs to the facility, and then we will be moving select local health department staff in there. So it's moving some back and moving some over.
Okay.
So,
no, go ahead, I'm sorry.
I was just going to, it's just some of the things, and this may help clarify a little bit what we're planning on doing. You can see there's three main things that have been going on thus far. We've had a series of planning meetings that we're doing every 2 weeks now that really help us identify all those little elements we don't want to lose sight of as we prepare for moving into this location. The timeline for the move, this has been done in collaboration with our county IT department. It has also been done in collaboration with the Community Health Center, since they are having staff that are leaving that building. The building preparation, we know that we're going to have to do some minor things such as cleaning. We need to get the phones reassigned for staff that will be moving and their computer placements, those kinds of activities going up. There are also some plumbing things that we're going to be working on as we prepare to move in there. And then we're going to get staff from the Community Health. The Central Park Community Center will be coming back over into this, along with our immunization staff will be moving from the main agency into this location. Again, by using this space, it allows us to keep our costs down related to developing some sort of space that's clinic driven. So this is already there. It'll be a great space for those programs.
I might note, we have Bill Kroll with Facilities Management at the back of the room, and I know that you're working closely in conjunction with facilities. So as we go through this process.
Yes, absolutely.
Absolutely.
Also, one of the big things that is very important as we move forward is our communication plan. We want to make sure that staff, partners, the community, and our funders all understand what's going to be in this location, when we're going to be moving, that we've got updated websites and brochures, the phone numbers are updated, all of those pieces that go into making sure for a smooth transition. It's pretty extensive, and there's a lot of people working on this right now. The big one that we can talk about, and this is just very high level overview of some of the things that have been happening the last few months. The 2600 Southwest East Circle Drive, or what we call the McVicker building. Our intent is to be in this location by June 14th, 2016. That's the end of our lease with Stormont at our current location on 8th Street. So we really want to be able to be in there at that point in time. You can see the programs that are going to be going in there include administration, and that's all myself. It's our purchasing, it's our payroll, it's our maintenance staff, it's finance, it's all of that that's considered under administration. We've got community health outreach and planning. This is where we have our health promotions, our public information officer, and Gatekeepers program will be here. We also have Emergency Preparedness and Medical Reserve Corps, our Family Health Services, which includes all our maternal and child health outreach things that we do. So First Steps, it's our nurse family partnership program. It is our maternal and child health newborn nursing visits, Healthy Start Home visitors. We will also have our WIC services here. One of the things that I didn't mention before, but just to make sure that it's aware, we will continue to have staff located at the North Annex. So those folks will be environmental health staff, which will work very closely with Public Works and Refuse and Recycling. And we'll also have child care licensing, one of the regulatory programs that's out in the field quite a bit. So moving back onto this. So the McVicker building, some of the things that we have been able to do is, certainly we know that we have a building that's been identified and a contract is in place for that purchase. It hasn't closed, but it is in place right now as we're moving forward. The property, as we know, it has very limited parking, but the county councilor's office is working very hard to find a solution for that particular issue. We are also working with Schwartz Design Group. They actually have worked very hard to evaluate the space compared to the local health department needs and develop plans accordingly. We're very, very close to having a final plan developed. Schwartz that group has been great to work with. They have been very responsive to us, and they have worked very hard to help us incorporate cost savings measures whenever possible. Bill Kroll was named as project manager. This was a huge success for us. We were able to have him use his expertise and knowledge, something that I don't have when it relates to buildings and remodeling and some of those other mechanical type issues that go along with that. But he was named as project manager, and we are very thankful for his leadership. It is allowing me to do more work within the health agency related to the separation of the community health center and the local health department, making sure that we've got all those things there and maintaining our current operations as well. He is also providing, allowing for us to provide input for the architects on what the needs are for the local health department, and plan for the upcoming move to 10th Street. So his time and expertise has been very invaluable, and I really appreciate all that he's done for us thus far. We've done a series of building tours. We've had county IT, emergency management, and our local health department management staff have walked through the space to evaluate and look for any issues that they may see as we're trying to move forward with planning, design. We've also been in there multiple times with Schwartz Design Group. They've walked through with us. Most recently, we were able to evaluate the plans, the most current edition of the plan. We were able to walk through and really look at the space while we're in there and compare it to the plan and make adjustments. We were able to actually find some additional cost-saving measures by doing that last walkthrough that we did. The designer was with us also, and she was able to help us to visualize what we're going to be doing, so she can help with the design for furniture layout and equipment needs for the space. So she'll be preparing, once we get a final plan, she'll be helping to review our inventory of our existing assets and see what needs to go and what doesn't need to go. So again, we've got quite a bit of activity taking place across multiple areas. So I just wanted to give you that update, and before we get into the next round, I'd be happy to answer any questions that you all might have.
Any questions so far?
Don't have any, thank you.
Commissioner
How many square feet are total in the McVicker building?
I think it's about 22,000 square feet.
22,000.
Correct.
Okay. Okay. Thank you. Thank you, Mr.
Okay.
Chair.
Okay, so we will go ahead and move on to the community health needs assessment, and so I'll invite Tom Llewellyn from Stormont-Vale to come up and speak with you.
Sit
Yeah,
here.
yeah, and if you want, or you can just.
All right. I'm Tom Llewellyn with Stormont-Vale Healthcare, and I'm here to give a quick update on our community health needs assessment. This is the second round we're doing this. We did the first one and completed it, I think, in March of 13. The final document was done. A reminder, the key participants in this are the health agency, St. Francis, and Stormont-Vale. And I do want to comment that we need to appreciate how these three organizations work together and do this. And this is the fourth one we've done. And it was a little over a week ago, Allison and I were at a Kansas Public Health Conference as presenters on how hospitals and agencies work together to do this, because that isn't always the case around the state. All right, what we're doing is we're going to look at the final report done by January through March, but right now we're in the data collection phase. I want to give a quick update on that. We've done our focus groups. We sent out a community health survey, and we have 1,362 responses, which is significantly more than the last time we did this. And we have 575 comments. These are just open-ended comments.
Wow.
The question was, what can we do to improve health in the community? And that many people responded, so that's another huge focus group out there. We're doing the analysis and prioritization of everything, and I assume the next quarterly meeting will come back and give the findings. I do want to just share a couple of key points that we've gotten out of the survey so far. We asked the question, what are the top challenges facing you or your family? And you could answer 3 times, check the box 3 times. Number 1 was last week's headlines, you know, obesity. And then the second one was high blood pressure, then joint back pain, diabetes, and heart disease. And if you think about it, all 4 of those are closely related to diabetes. So this is one of the key issues we are facing out there. The other question I'm going to share with you is we asked, what could we do to improve the health of you and your family? And the top question at 36% was healthier food, and then safer places to walk, recreational facilities, wellness, and affordable health screenings. It's interesting here that those first 3 questions are all kind of lifestyle related. It's not like, well, we need more physicians, or you know, we need a pediatric endocrinologist or something like that. It's lifestyle issues out there, and wellness and affordable screenings are the ones out there. But that's just a quick update. We've got a lot of information, and like I said, I'm sure we'll give you a much more detailed report next quarter. Any questions?
Any questions?
Great, thank you.
Okay, thanks.
Yeah.
Thank you.
Thank you, Tom. We are now going to move over to let Dr. Pizzino, the Shawnee County Health Officer, give us an update on public health and working to create a culture of health.
Good morning, Commissioners, and that was a wonderful introduction, actually, to some of the content that I have in my portion of the program, and I hope you will see the connections in a couple of minutes. So what I would like to do in the next few minutes is to look at public health in the 21st century and see how public health operates in the current environment and how we can go beyond what they call the silos mentality, which is one program at a time and one activity at a time. And part of this was prompted by a presentation that we saw at the Kansas Public Health Association a couple of weeks ago from Paul Kuhner, who is a senior program officer at the Robert Wood Jones Foundation, and part of my slides are borrowed from his. So I don't know how many of you are familiar with Dr. Samuel Crumbine. He was a pioneer in public health, both in Kansas and actually nationwide. He practiced medicine the first half of last century, and these are some of the things he's credited for. Things like the Swat the Fly campaign. He quickly realized the important role of flies in transmitting communicable disease, and he partnered actually with building companies to advertise that message and propose to fix people's homes with screens and other measures to prevent flies to come in contact with food and people. Another element here at the bottom is getting rid of the common drinking cup, which was actually in use for many, many years, even after he left his position in public health. That was probably the hardest to battle to win, or the one that took the longest. And the last one you see is actually this. Don't spit on the sidewalk. There was a campaign that he launched to prevent the transmission of tuberculosis. Now, let's put aside the fact that there was really no scientific merit in that, in the sense that tuberculosis is not transmitted by spitting on the sidewalk. But the point is that he decided to partner with brick companies and to have them imprint this message on the bricks that they were scattered throughout the city of Topeka, so people would see that message. So these are examples of innovative cross-sectional, cross-sector approaches that he followed, and I would like for you to keep this in mind when we wrap up this portion of the program. When he was a physician in Kansas, and he was the first, I believe, dean of School of Medicine, actually at KU, these were the top 3 causes of death in the 1900s: pneumonia, tuberculosis, diarrhea, all three infectious. As you can see over the years, we managed through interventions like those that Dr. Crumbine was advocating, and immunizations and sanitations and so on, we managed to actually cut the number of deaths from these diseases by an incredible amount, to the point that we actually added about 30 years of life expectancies over that period to the average life of someone born in the United States during those years. So an incredible achievement of public health. However, the epidemiology transition that happened in the last part of last century and then in the 21st century was such that while you can see on the green line, pneumonia, tuberculosis, diarrhea, other infectious diseases really dropped as a cause of death, other causes took over. And they were primarily heart disease, cancer, stroke, things that are linked primarily to lifestyles and the environment in which we live. So, of course, the job of public health was not done. Shawnee County is not any different. These are the causes of death in Shawnee County between 2011 and 2013. And you can see that all of them, with two exceptions, septicemia, pneumonia, and influenza, are linked to chronic factors, chronic disease, and lifestyle. And I would also like to point out that pneumonia and influenza are actually preventable through vaccination, and at least to some extent. So how do we promote and maintain health in such an environment? So that's the question that's really the core of my conversation with you today. Is money the answer? Money never hurts. But what I would like to show you is that the issue, I don't think, is that we need to throw more money at the system, but the issue is more on how we spend the money that we are already spending. Some of you may be familiar with this chart or something similar to this. You can see here on the horizontal axis the total expenditure on health per capita. And the vertical is the life expectancy at birth. And you can see there is a pretty clear line around which most states or countries better are clustered. This shows that the more you spend per capita and the better the expectancy, life expectancy. One big outlier, and that's us. We are almost off the chart here. We spend more on per capita basis on health than any other country, and yet look how low we are. Our life expectancy is lower than most other countries like Portugal. I mean, there is no reason why we would have to spend that much money and get such poor return on our investment. Americans live shorter lives, and yet we spend more money than any other country. Why is that? 97% of the money is spent on healthcare, and 3% roughly is spent on public health and prevention. So that chart that I just showed you would be particularly perplexing if the assumption was that healthcare is equal to health. And that's the assumption actually that I'm going to challenge. What we know today is that what determines health is about 20% the healthcare portion. About another 20% genetics, and there isn't a lot we can do about that. But the remaining 60% is social, environmental, and behavioral factors. So we spend about $2.7 trillion a year on what causes about 20% of the health of our communities. And so what is the result of such poor investment in prevention and social services? You're probably familiar, you remember from other previous meetings, these are the county health rankings for Kansas, and in green you see the health outcomes, how healthy our communities are, ranked, dark is worse. In blue you see how they rank around social factors that determine health, and again dark is worse. And I think that, you know, the relation is pretty striking to me. Look at the southeast corner of the state. Very dark on the health factors, very dark on the health outcomes. So that's what happens when our investment is misguided and goes 97% in what causes only 20% of health in our community. In Shawnee County, things are not very different. we rank 87 for socioeconomic factors throughout the state. 37% of children in our county live in single-parent households compared to 29% in the rest of the state. We have a high school graduation rate of 78% compared to an average of 85% in the state. These are all things that affect health. So it's not a surprise that when we look at our health outcomes, we are also not faring very well. We have a low birth weight rate that's higher than the average in the state. We have a rate of premature death that is higher than in the rest of the state. So the main question, of course, is how do we address the social determinants of health? One way to do that is by investing in social services. And that's what other countries have done, and I will show you in a moment some figures. Things like employment programs, housing programs, nutritional support, educational activities, other social services. They are as related to health in our communities as it is how many nurses we put in our hospitals, or even how many nurses we put in our local health department. So how do we do in the United States? Well, you can see here in green is the investment as a percentage of the GDP in health for each country. And in orange is the investment in social services. So you can see immediately again, United States invests more than any other country in health. That's the tallest green bar. But when you look at the orange bar, it's pretty short. It's one of the shortest of all industrialized countries. And in fact, in the US, $1 is, for every dollar spent on health care, about 90 cents is spent on social services. In other countries, it's 2 to 1. So when I look at numbers like this, I think the assumption that more health care is equal to health, of course, proves to be false. And the reason why our huge investment in health care is not producing the expected results also becomes more clear in my mind. So how do we bring all this together? What does it mean for public health in the 21st century? That's one of the questions that a panel of the Institute of Medicine in 2012, that is one of the branches of the National Academy of Health, it's one of the questions that that panel tried to address. And they decided to define a minimum package of public health services for the 21st century, and then some foundational service areas and capabilities for public health. And I will show you what that means. The minimum package means that there are areas of expertise that every local health department should have, no matter where that health department is located. And there are many of them. There are only 5 that are listed. Communicable disease control, chronic disease injury and prevention, environmental health, maternal, child, and family health, and access to and links to clinical care. Every health department should have that. In addition, depending on local circumstances in each community, there are additional community-specific activities that people may want to introduce and implement. Mental health, substance abuse, sexual transmitted disease control. Nothing terribly new here, but here is where I think the innovative approach is. That panel said, in addition to those services, there is a group of foundational capabilities that create the foundation for those services to operate effectively and efficiently. And these are things like epidemiology, surveillance, preparedness and response to disasters, leadership, policy development, information technology, performance management, quality improvement, community partnerships. Now, these are the things that sometimes are hard to quantify in terms of outputs. If you fund a nurse to give immunizations at the end of the year or every month, you can count how many immunizations the nurse gave. If you fund the foundational capability, you may not be able to count the level of output. But yet they are essential. This is a diagram of what the Institute of Medicine created. Those capabilities are here at the bottom. They support everything else that stands on top of them. So without those capabilities, the programs that we want to implement, the chronic disease prevention program, the community disease prevention program, are not going to be as strong as it should be. How are we doing in Shawnee County? We are doing well in certain areas. We are not doing so well in other areas. Our health department is the only urban health department in the state without a trained epidemiologist. There are urban health departments and they say they have a whole epidemiology section. We don't have a single trained epidemiologist. And I understand that one was in the books for next year, had to be postponed because of the budget cuts of the agency. We do better in other areas. Community partnership and development, you just heard about that. We are one of the strongest health departments when it comes to developing relationships across governmental and not government agencies to do community health assessment improvement plans. Remember, those are all foundational areas. Some people find it hard to understand the importance of these areas. And some people are misguided and decide that this is not stuff that matters. What matters is really how many services we provide. The Sedgwick County Board of County Commissioners, about a month ago, totally eliminated the line item in the budget for community health assessment. It would be interesting to follow in the next few years how that impacts the quality of services provided by the health department. So I want to congratulate you as a Board of Health and Board of County Commissioners for not having taken that approach. Because when people take that approach, this is what happens. If you imagine public health as a tree, the branches are the areas. Those are the programs, the services. Those are the things that we're more familiar with. Those are the things you hear from staff at the health department more often than not to report to you. Immunization, MCH, and so on. But the foundational capabilities represent the trunk and the roots of the tree. And so what happens when you have a tree that's heavier at the top than what the trunk and the roots can support? It's not a healthy tree. It's a tree that eventually will break. What does it mean in terms of public health? It means that you would probably have ineffective and inefficient services. It means that you may not be able to recognize trends in disease as promptly as you should, outbreaks of disease as promptly as you should. So why does it matter? You are the Board of Health. You have a responsibility to promote and maintain the health in our community. In the 21st century, this requires a cross-sectional and multi-sectorial approach. It's the analog of what Dr. Crumbine was doing with the diseases he was fighting last century. But public health matters because of the health that it promotes and maintains, not because of the kind of diseases it tries to prevent. So the approach really doesn't change. Support to social services to public health is equally important. And I think you heard me saying this before, and you will probably hear me saying this again. When you make decisions on social services, you make decisions also about the health of your communities. And most of all, let's try to build a strong tree. Let's try to build a tree where foundational capabilities are supported as they should be and not just individual programs, individual silos. That's all I have for you, and I don't know if you have any questions. As you can see, I'm passionate about this issue, and I hope that my passion will be transmitted to you.
Commissioner Bueller,
I don't have anything to add. Excellent.
Commissioner Archer.
Yeah, very good. What did Sedgwick County Commission do? I missed that.
They severely cut the budget to public health services, and particularly they cut the things that I would classify as foundational capabilities, including that example I was giving you. They totally eliminated the budget line item for community health assessment, for example, which was what Allison uses when, she dedicates part of the staff time to doing things with our hospitals and to develop the need assessment for our community. So how they're going to do the next community health assessment, I'm not sure. It's one of the things that the health department is uniquely positioned to be a leader in. And yet, if there are no resources assigned, it's hard to justify that kind of investment.
I think, didn't Sedgwick County have quite a bit of turnover in their commissioners with different views of,
Yes.
of things that are important? What about end-of-life care? I hear people tell me that are older that I've just spent 100 days in the hospital. Seems like, does that drive cost up dramatically?
Yes.
We're all trying to figure out why and what we're getting for our money. It seems to me that that is a big issue in the United States.
Right, it is a big issue. I don't have the numbers with me, but I
Okay.
remember seeing some figures that a huge proportion of healthcare spending actually happens in the last 30 days of life
Yes.
of an individual, and
Yeah,
it's
that's
often related to hospitalizations that are, I don't want to use the word unnecessary because it really has a judgment connotation, but maybe it could be prevented, or for palliative care that could be provided outside a hospital through hospice care or other arrangements that would be less costly.
Okay, very good. Thank you, Mr. Chair.
Doctor, can you tell us just a moment how the epidemiologist, and I probably mispronounced that, would help the cancer, obesity, high blood pressure, diabetes in Shawnee County? How would Shawnee County's investment in that position address those top health concerns that we see in Shawnee County?
The first simplest thing that comes to my mind is that there would be someone who would be dedicated to tracking the prevalence of those conditions, not just in the community as a whole, but also in subgroups of the communities, because those conditions do not affect everybody the same way. Then that person is a person trained in understanding what are the proper interventions to address different target subgroups for different issues, and will help local department staff target those interventions, and then would track the results of those interventions. So essentially, epidemiology, how much time do we have? I'm a trained epidemiologist, so I have pretty strong feeling about that, but originally was funded as a discipline to support just the spread, to understand the spread of communicable diseases, right? And now it has evolved into something that uses the same methods that were used last century to understand the distribution of risk factors in our communities for disease and the distribution of those diseases that we have to fight in the 21st century. So that's essentially what the person will do, using those methods to understand how the social determinants are distributed in our communities, who is more affected than other people, what are the right interventions for those groups, and how those interventions translates into changes in outcomes.
Any other questions out of that?
No,
All right, thank you very much.
Thank you.
very good.
We're gonna go ahead and move over into some activities that are occurring in WIC that we just wanna update you in, and I wanna flip the pages. I can actually do this while Linda's at the podium, but Linda Oakes is gonna speak to us.
Good morning, Commissioners. You might remember earlier in the year I came to talk to you about a new project we were going to take on called Next Day Scheduling. And so in the past, if you needed a WIC appointment, you were already in the program, you needed another WIC appointment, you would schedule that appointment 3 months ahead of time. And I don't know about you, but I don't know what I'm doing in 3 months except coming to work. So that was pretty tough for a lot of our clients. We also had a requirement to see pregnant women and infants within 10 days and new children within 22 days. So they didn't wait that long, but it was pretty tough to get them in. So we had a lot of no-shows, and clients would call in to reschedule, and oftentimes it was 2 or 3 weeks before we could see them, so maybe their checks would lapse. So starting April 1st, we began this program called Next Day Scheduling, so clients can call in the day before they need to be seen, and we have a queue system that Brian put in from IT. It's an excellent system. It's working very well for us. And we have informational messages while they're on hold. I'm happy to say that people are not on hold very long, and that if you call in by noon, you can get an appointment tomorrow. That's how it's spread out. So nothing I thought would happen has happened, that the phones would be ringing off the walls, and they really haven't. So it's just worked out really great. You might remember this slide. This was December 5th of last year. The yellow is all the reschedules and no-shows, and keep in mind we double booked on these days. So we had a lot of time that we weren't seeing clients, and it was very distressing to us and all the staff. So now I'm going to show you the best day we've had so far. So 2 little times we had no-shows and reschedules. That is our best day, but our reschedule and no-show rate has dropped from 35% to 16%. So we feel like it's just absolutely a win in this area. So people are getting in and being seen very quickly. This is probably the worst day we've had so far. And the person who had the most openings, Angela, she's the one who just resigned. She was our grocery store person. She took care of all the vendor information. So she used that time to work on that. But as you can see, that's still much better than we had before Next Day Scheduling. So we're doing a survey right now to see what the clients think about the program. There is a work group of different staff people who are working on it. I'm happy to say that we're going to be able to disband that committee. So that always makes me very happy. So we're the first in the state to have this program. We did learn about it at a national conference, and it's interesting. It wasn't even a breakout session. It was a poster session. So it's one of those things we probably wouldn't have seen just from seeing the information online. So I feel like it's a great win for us. A lot of the other bigger counties in the state are looking at it and asking questions, and we'll probably present either a poster or a presentation at the next state conference, and we're talking about doing a poster for one of the upcoming national conferences because we think it's been so successful. So I'd be happy to answer any questions about it.
Any questions?
Oh, okay.
Good progress.
Thank you.
That is good. Do we have any sanctions, or maybe I've asked this question for no-shows? I know if I don't give my dentist or my doctor 24-hour notice, they're going to charge me
Right.
for it. Do we have that? Would that help, or have you thought?
We
about
don't
that?
have sanctions. What happens though is that your checks run out. So you can't get your formula or your food or whatever until you come back in and get those checks renewed. So you do, your checks stop working, they expire.
Okay, so there's a motivation
Yes,
to come
yes.
and to be there when you say you're going to be there.
Correct.
Okay, that's all I have. Thank you, Mr. Chair.
Linda, I just might note that this is good use of communities' resources and Shawnee County's resources. Time is one of the most elusive factors in any workspace, and making sure you use your time efficiently, this
Yeah.
appears to be doing that. So less downtime, less gaps, and so very good.
And I would just add, staff satisfaction is so much higher. I mean, it's hard to
Yeah.
know when you need to be off in 3 months. But for instance, today, we knew we had 2 dietitians out. We saw late Friday that Central Park, which is one of our clinics, didn't have any appointments, so we closed it, moved that dietitian over to Maine, and are able to see people there. So that flexibility is huge for us now. It's
Great.
really working well.
Very good. Thank you.
Good.
One more quick program I wanted to talk about for just a minute. We're entering into a partnership with KTWU, Public Television, to do a program they call Ready to Learn. They're going to provide us children's books, like little cardboard books and different books, and programming in our waiting rooms for WIC and immunization. So there'll be age-appropriate activities, and they'll replace the books as needed. So those books will be available to the family. So we haven't quite started yet. We're getting ready to pilot it at the Maine, since immunizations is just going to be there for a short time. We're going to start with the books, and as we move, we will continue it with the programming. So
Very good. Thank you.
That's Daniel, Tiger, and Barney, by the
it
way.
is.
Point
Glad to
that
know
out.
that.
As a grandfather, I'm
I didn't know
You're
Daniel Tiger.
familiar
Both
with
these-
both of
I'm
those.
familiar with
Both
those,
these
yes.
characters are going to be in town in October and going to visit our waiting rooms, so
Oh.
Cool.
wow.
kids will get a visit. Thank you.
Okay, so now we have an exciting announcement. This is some work that Teresa Fisher is going to come up and talk about. This is very tied to our community health needs assessment and our community health improvement plan work.
Good morning, Commissioners. Teresa Fisher. I'm with the Health Agency, and I have the pleasure of co-chairing the Healthy Babies Work Group, which is a subgroup of the Heartland Healthy Neighborhoods, which came out of the Community Health Improvement Plan. Our overall goal has been to work in reducing infant mortality in our community. And so early on, this group became very committed in trying to look at some strategies and action steps that we could take to hopefully improve that rate in our community. The Kids Network, which you'll see their logo down there, has been very successful hosting these community baby showers for safe sleep in their neighborhood, in their communities. And so we, with their technical assistance and their online assistance, we have one planned. It's our first one. You can see up there, it's scheduled for Saturday, October 17th. It'll be over at Avondale East. The event is open to anyone in our community. However, we are targeting the 66605 zip code. The reason behind that is that has historically been the highest rate of infant mortality in our community. And so we are hosting it over there. This group initially had applied for a grant for community partners, and that grant wasn't received. And so I couldn't have been more proud of the community partners that sit at this table saying we want to do this, what's it going to take. And so there was some financial resources that were needed, but it's also the time commitment and the staff commitment that community partners have come forward and said we want to do. This is not a marketing event, this is an educational event, so we will have information that are available in our community resources. Based upon availability, participants will leave with a portable crib, also known as a pack and play. They'll have a safety approved sleep sack and a pacifier. So We are putting information and hopefully products into homes that we know that sleep-related deaths are preventable, and we hope to be able to impact our infant mortality rate by hosting this event. Are there any questions?
Questions?
Good.
Great, thank
Very
you.
good.
Before Teresa goes, could I have Teresa just speak very, little bit on the marketing and some of the partnerships, what they're doing to help get the word out?
Yes, absolutely. So the marketing piece, it's printed. I do have one of these for each of you.
Okay.
So we're really, really excited. One of our biggest partnerships and marketing piece is the Metro. The Metro is going to do a lot of marketing in their new Flex route. And also the California bus stop, and they just recently, last week, agreed with these postcards. Participants are going to be able to receive a free ride to and from the event. That's a huge win for us. Transportation is a big issue, as you are all aware, in our community, and so we didn't want that to be a hindrance for women not being able to come and receive their portable crib to take home. So we're very excited about that. We've also partnered up to get marketing out to the schools that are in that identified area, the food pantries, churches, lots of different community businesses have the information. So we feel like we're also working with, we've got both hospitals represented and all the prenatal care providers. So we're trying to have wide-reaching marketing to get the information out. We won't turn anyone away, like I said, but we are really hopefully targeting that area that's had this infant mortality. And we do have a wide variety of different community partners at the table representing all sectors that are interested in the health of our youngest citizens.
Awesome.
Great, thank you.
Okay, moving on, Ed Kalis is gonna come up and he's gonna talk about the consequences, unintended consequences of rabies, so we'll let him speak out. You can either do that or you can do that.
Good morning, Commissioners. Ed Kalis. Happy World Rabies Day. Today is the day. So
No.
it is, really.
That's
Now, I know we've talked about rabies before, and I just wanted to remind you of potentially what a complicated investigation a rabies investigation is. Typically, we find out about rabies through a bite report, and that would come from animal control, either the city or the county. And I did want to introduce Linda Halford back there. She is the lead for the city's animal control. She and her investigators, and then officers who respond to bites when they're not on duty, take care of that. And then for the county, Vicki Hamilton is the lead, and she wasn't able to be here today. But those are the first pretty much line of defense for us to be able to find out what's going on with rabies in our community. But before I get into our community, I just kind of want to let you know a little bit more about rabies first. Rabies is a viral disease it travels from a bite or a wound or something else where the saliva of an infected animal gets into that bite or wound. It travels through the nervous system and then basically attacks the brain, causes severe swelling. Complications include temperature, fever, tingling at the bite site, foaming at the mouth when it gets to advanced stages. By the time symptoms start, that animal typically will not survive. And when I say animal, that will include people. And that is basically our main concern, but we do worry about other animals too. In the world, the main reservoir for rabies in other countries are dogs. And those are the ones, if you're going to die from a rabies bite, it's going to be from a dog that's in the village or wherever else you happen to be. In Kansas, the main reservoir are skunks. In fact, last week we wound up testing a skunk, and it was rabid in the northwest part of the county. And in that investigation, which I'll get into a little bit more about my main point here, lots of things to look at. So in addition to the animal control, we have the hospitals. The emergency rooms will be some of the first people to report the bites, and they were required to report those. So animal control, the hospitals, other physicians, vets are all part of the rabies control system in Shawnee County. In our agency specifically, we have disease control nurses who get those bite reports and work with the patients and determine whether a bite's actually an exposure. We also work with KTWU to find that out. And then once an animal's quarantined through animal control, our environmental health people will go out and look at the dog after the 10-day quarantine to verify that the dog is still alive and acting appropriately. So it's a big system. Now, in all of that, a lot of people are kind of familiar with how it works, but there has been one unintended consequence that I've noticed over mainly the last couple of years. It's when people don't vaccinate their animals and their animals are bitten by a potentially exposed animal. Most of the time, like I said, we talk about people. this particular thing I want to talk about today is what happens when an animal bites another animal. So if your dog is bitten by a coyote and it's not current on its rabies vaccine, how long do you have to leave it in quarantine? This could be rhetorical, or you can just jump right in and answer. That's completely up to you.
60 days.
60 days. Any other choices? I already mentioned 10 days, and that is a quarantine period for if a dog bites a person. That dog will be quarantined to make sure that it doesn't have rabies, because within 10 days, if it did have rabies, it would either be dead or close to being dead. 45 days is if a dog is bitten by the coyote. That's how long we will observe them if they are fully vaccinated. So we still have to watch the dog to make sure. Because like a lot of other vaccines, we can't count on them being 100% effective, because rabies is pretty much 100% fatal. So we do not let that pass. 60 days, I think that had something to do with larger animals like elephants and whatnot, and that'll depend on the vaccine and the type of animal that it is. The answer is 6 months.
Wow.
6 months is a lifetime for a dog. We have had a number of dogs in the past couple of years where we've actually done that and worked with the owners to quarantine them for 6 months. Does not work out very well all the time. Typically, after interviewing the animal control folks, we found out most people who find out their dogs aren't vaccinated, cats aren't vaccinated, they will euthanize the animal once we tell them they have to be quarantined for 6 months. And that's kind of been the pattern. But in the last couple of years, more people are wanting to keep their animals.
Yeah.
Highly expensive on their part and on ours. If we make them go to a vet, we're looking at about $1,000 a month for keeping that animal around. If we do it at their house, we're looking at the cost of time it takes for staff to go out there and verify that the animal's still alive, acting appropriately, it's not exposing anybody else. It is a large deal. Now, this can simply be prevented and go down to 45 days, which basically we call you at the end of that time and say, is your animal still alive? And they can say yes or no, and typically we go out and look. But 6 months, it's a lot different. It is a lot different. So bottom line is, please vaccinate your animals. That's the message to the public. Shawnee County only requires vaccinations for dogs, and rabies can be transmitted to any warm-blooded animals. The city of Topeka requires all domestic animals are tagged, and to get a tag, I'm sorry, not all domestic animals, cats and dogs. To get a tag, they have to have a vaccination. So it's not happening. People are not vaccinating their animals, and they are very surprised with the unintended consequence of being told their animal has to be in quarantine for 6 months. And at this point, we help them along in that process, but someday that may become too labor intensive and too expensive on the county's part. And the ultimate thing is either spend a lot of money or have the animal euthanized and tested. So it's just a word of advice: have your animals vaccinated and keep it up. Because if they're not current, it really doesn't make any difference to us. It's still 6 months. Anybody have any questions?
Questions?
Helpful.
Can you just talk about the effects to the dog or the cat that's in quarantine, what their experience is like?
We have actually had a lot of vets who will not quarantine an animal for 6 months because the quality of life that they will have is not good. We've had one puppy that had bitten a baby, and they wound up putting the dog down because at 3 months old, that puppy's going to need attention, contact, and to be able to socialize and grow in that family as the family expected to have happen in the first place. And unfortunately, at a certain, I don't remember when the first rabies shot can be given, but it's like measles and chickenpox. The 1-year-olds are more, going to have a problem. Same thing with puppies. So it's not good for the animals. It's especially not good for the animals. We had the one with the rabid skunk a couple weeks ago, on and off with the owner on whether or not they were going to euthanize, and we thought we had them almost convinced to quarantine, but in the end, because of the total circumstances of their situation, they wound up putting 2 dogs down. The skunk had gotten into the enclosure, and they all fought and were wounded, so there was no question that they had been exposed to rabies. So that's what happens. It either dies, it costs a lot, or it's going to be quarantined and potentially affected emotionally and socially for a long time after that. Now the health officer, we get the information, and just like a lot of other things, he will take that depending on the situation, and we will work with him and the Kansas Department of Health and Environment's vet and come up with an action plan for individual cases depending on the situation.
Sure.
Yes, thank you. First of all, I should point out that a lot of cats and dogs are not tagged in city of Topeka. That's just not done, unfortunately. The question I had was, how many cases do we have of humans that got bit that are subject to treatment for rabies over
As far
5 or 10 years?
I don't have that number right now. We get about 250 to 300 bite reports.
Right.
And I would say, based on percentage, and I'm just guessing, I would say 50 to 60% of those we would recommend that they get the shots.
Okay.
Either the animal's escaped and animal control can't find it, or we wind up testing it and well, we haven't had a rabid animal other than the skunk in about 3 or 4 years.
Okay.
So yeah, there's a fair amount. I would say over 50%.
Well, but you don't hear much about it.
No, you don't.
And it's not rare, obviously, from what you're saying.
It's rare that the disease shows up in testing, and thank goodness we have not had a human get it, because Alice and I have both decided that we'll have to leave town if that happens. Because it just doesn't happen. I think the last case with this is in South Carolina a couple of years ago, and that one, I think she survived.
I think so.
Yeah. So unfortunately, I can't say the fatality rate is 100% because they received treatment and they were able to survive the disease.
Thank you.
Thank you. Thank you, Ed.
Thank you, Ed. Okay, so now I'm going to transition over to Misty Kruger, our Public Information Officer, and she's going to talk about some of the health outreach activities we've had.
Good morning, Commissioners. Well, I'm going to bring us back around to what Tom and Dr. Pizzino were talking about earlier, and it's more than just access to health care that impact the health in our community. One of the things you guys have heard about recently, and I'm just going to kind of give you an update, we received a grant from the Kansas Health Foundation a while back, and one of the outcomes of that grant was the start of farmers market in East Topeka. East Topeka, because we know it has a food desert in that area, meaning that people don't have access to fresh fruits and vegetables. And so we wanted to really look at this area. There are no farmers markets prior to this one starting in that area for those residents. And our overall objective from the beginning was that we would help get it up and running, but we would partner with an organization within that community for them to really take it over and it be their farmers market. After talking to some different farmers, we decided that we would host it twice a month. So it was the first and third Tuesdays from 4 to 6. This was partly picked because it was new to us. We'd never really started a farmers market, and we wanted to make sure that we were able to maintain and do what we needed to do to make it successful. So we originally partnered with the Avondale East NetReach Center and the NetReach program there through the mission. We had a kickoff event on April 23rd. This event was in conjunction with their quarterly meals that they have for the neighborhood, and so we thought, it might bring a good showing of people to the farmers market. That wasn't exactly the case, but that's okay. So we ran the market there from April through June, and the attendance ranged anywhere from 5 to 26 people a week, which really was troubling to us, and we did some different marketing things and really tried to promote it within the area, and it just didn't take off. And then NetReach had some staffing changes within their organization, which caused us to have to stop the program there and reevaluate and look for new partners because they couldn't continue with the agreement. So it actually kind of worked out. So we went to the Topeka Housing Authority, who has their office right across from our California clinic, and they were more than willing to jump in and be a partner in this project. So we moved the market there. The first one there was in July, and we have had anywhere from 35 to 45 people come to the market each week, so that's a huge improvement over what was happening at Avondale. Obviously there's still a lot of work to do, but it's new and we're still getting people used to it. So the Housing Authority stepped in. They've put in some permanent signage at their location. They've assisted with marketing through the people who live in their housing areas. They come out to the market every single week and bring out tables for vendors, things like that, which we really weren't getting at NetReach. So it's really been a good partnership for us. Obviously I made this slide a while back, so, but the part where it says the last 2 markets had 38 to 45 people, they weren't the last 2, they were just the last 2 when I made the slide. But we had storms roll through both of those markets. We had lightning, heavy rain, and we still had 38 and 45 people come out to those markets. So we have people who are coming every single week, the same people coming through. We have new people each week as well, and we even have vendors who are running out of produce because they're selling out at the market. So it's really exciting. There's a lot more we can do though. So what's going to happen with the market? We're at the end of the season. We're going to run through October as long as the vendors have produce, which we know for sure the first week they will. The second, the third Tuesday is questionable at this point. But
We have one vendor who's very interested in looking at the senior farmers market program, which is a voucher system for seniors, and they can bring their voucher to a farmers market as long as the vendor accepts it. It's $5, so they can use that voucher to spend $5 on produce, and then the vendor turns that voucher into the state to get reimbursed. So we have one vendor who's interested in that. We have an opportunity for a partnership. A partner has applied for a grant. They've run regional farmers markets, and they've applied for a grant for Shawnee County to look at SNAP markets, and they've picked this market to be the market they're looking at. The Housing Authority is on board with this and is very interested in doing that. So people will be able to come to the market and use their SNAP cards, get cash or vouchers, tokens, however it's set up, that they can go spend at the market. And then the vendors accept those tokens, and then they get reimbursed from the market itself. And it would be run through a partner, not through us or through the Housing Authority. So those are both incredible things that will increase people coming to the market, and especially in this area, we know that there would be a great need for that sort of thing to happen. So we're getting ready to meet with the Housing Authority in a couple weeks to start looking at next year and what we want to do to increase this market and start moving a few more things over to their hands. We're looking to increase vendors. We're looking to increase the hours that the market runs, increase their frequency. People who are coming want it more often than twice a month, and the vendors that we have produce to sell. So they're interested in that as well. And then increasing the marketing again, just to help get the word out in the area and make sure that people are aware that that's there for them. Okay, I'm moving on to a new topic. So any questions about the farmers market?
Questions?
One of the other things that we've been doing, we've been hosting freedom from smoking classes, and I know you guys have seen the press releases that go out when we have these, but we know tobacco is a major health issue, and we know it's one of the most preventable causes of illness and death in the U.S. So what can we do as public health to impact tobacco use? When we did the 2012-13 health needs assessment, we learned that 20.5% of pregnant mothers in Shawnee County smoked while they were pregnant, and 17.9% of adults in general in Shawnee County smoke. The Healthy People 2020 goal is to have 12% of your population that smokes. So we have some work to do. And so we've partnered and sent 2 of our staff members to be certified trainers for the American Lung Association's Freedom from Smoking program, which is an evidence-based program. So we've offered 2 sessions so far, and the 3rd one actually starts tomorrow. So we did one in January, one in June, and then the one here in September. From that, we have had 11 people who have signed up for the 2 classes. We have to have a minimum of 5, so we're hitting that minimum for the program. Of those 11, 7 people have completed all 8 sessions. This doesn't mean they haven't completed the program, but maybe they had to miss a session. I know in the first session we had someone who had came to the quit date, and they just weren't there yet. They weren't ready to quit. So they dropped the class, and then they came back and completed it the second time that we did it. So 7 people doesn't sound like a huge number of people, but what that means is that we've saved over $18,000 in healthcare costs per year. This is things like hospital stays, extended doctor's visits because of issues relating to smoking cigarettes. And then we've also saved almost $31,000 in reversal of income due to absenteeism and lower productivity, and this is for employers. So when you have staff who don't come to work or who are at work but they're not as productive as they need to be because they're sick and they don't feel good because they have other health issues related to their smoking. So it does make an impact in the community, and we hope to continue seeing an increase in these classes. The people who completed the first class actually still get together, I think monthly, and go to lunch together and just continue to be a support system for each other through their process of quitting. So. And then one last thing I just wanted to touch on, just since the last Florida Health meeting, so just since June, we have attended as the local health department only, this does not include community health center activities, 13 health fairs where we've provided information about our programs and services. We've hosted or taken part in 37 different events. This includes things like the panel discussion we did on vaccinations, and we showed the video calling the shots. It includes the school immunization clinics that we're doing right now in the middle schools in Shawnee County. We've done 19 different presentations, and this is staff going out into the community. We go into the schools and talk about hand washing. We talk about healthy eating, physical activity. We partner with community corrections for people who are on parole. We go in and do STD presentations for them. So a wide range of different topics that we provide as public health. And we've had 43 media contacts just since the last Board of Health meeting. not always things that we respond to. We may say, you know, that's really not our element, but here's who you need to talk to, and we refer them on to another community partner. But 43 times that we've been contacted by local media for something since June. So, and with that, I would be happy to answer any questions that you might have about this.
Any questions from Misty? Very, very busy with all
Yes.
of the activities.
Yes.
Thank you.
That's actually the end of our actual presentations. I did just want to note on Misty's areas, the work that we're doing with the farmers market and with the freedom from smoking, those things are very spelled out in our community health improvement plan. So those are things that we are working on. And then the media engagement outreach activities, that is within the local health department's strategic plan, that we really want to increase that activity within staff across the agency. So you're hearing about some of those things, the results of what we've been doing. So with that, I don't know if there's anybody here that's interested in talking, but I'm happy to answer any other questions or your questions.
Are there any members of the public or members present that have any public comment? Yes, Commissioner Bueller, do you have any?
Well, thank you for all the action. I mean, you all certainly are very, very busy, and I appreciate all the different sectors who are involved. That's going to be huge. I mean, most of this work is not measurable until many years from now, but I think you all know the importance of that, and so thank you for your action. It's very much appreciated.
Commissioner Archer?
No, I appreciate it also. I know when I was chair last year and you came up with the idea, let's have a quarterly meeting, I thought it was a good idea then. I think it continues to be a good idea. And thank you and Dr. Pizzino and everybody that participates. It's appreciated. Thank you.
I want to take a moment and just, I mean, I think it's maybe not always done, but thank you, Commissioner Bueller, for everything that you've done with the Community Health Improvement Plan, chairing that, really bringing this to the forefront, but also the facilities manager. You fought very hard to get that position established. We're seeing the fruits of that with Bill Kroll and his work and working with the health agency as we get the building put into place. And so thank you for everything that you did. That was very well deserved. And working with Bill and then the health agency as we move forward, all of those pieces come together, really starting with the foundation of having a good building, the programming, working with the epidemiologist, and those things are coming. And so I would say in the future, those are things that we need to, by having the quarterly meetings, we're able to see the need and really address one-on-one as a community what those needs are and how we might better do those.
Well,
So,
thank you.
Thank
But
you.
it's all of us working together, so not
But
just me.
I might also note that June the 14th is 3 days before my birthday, so that would be a happy birthday present to have you guys all up and running on the 17th. So thank you, Allison.
Thank you.
I think that would then conclude the Board of Health meeting. We are adjourned.